So welcome, my name is Dr. Eric Kaler. I'm the founder and owner of Physical Achievement Center. And I'm really excited you're here. It's a topic that's very near and dear to my heart. I have led a team here for the past 6 years at Physical Achievement Center. And this is important to us to communicate to people their options so they can make great healthcare decisions. Today, of course, I'm going to provide some information about us in the clinic, about what goes on with ankle and foot issues that might lead people to difficulty. We'll have a chance to see a 5-minute miracle, which is a favorite part of the presentation. And then, of course, at the end of it, there's going to be an offer for you to continue an exploration of how we can help you out for the concerns that you brought to me here. So, everybody can hear me okay?
Yep.
Great. All right. So, I've got a ton of information to give here, and at Physical Achievement Center, we help people to achieve greater mobility and strength for their active life without medications, drugs, and surgery, even when nothing else has worked. That's been our focus since we opened the doors. It continues to be our focus. A little bit about myself. I've got over 30 years of practice, nearly all of that in the Oshkosh area. I had the privilege of training as a fellow in the American Academy of Orthopedic and Manual Physical Therapists, which is a mouthful. Basically means that I had a chance to learn all the top research and clinical applications of pain relief techniques from head to toe. And I've been able to help a number of folks. Based on that knowledge and skill set, I pursued opening up an independent practice. Dr. Jessica is another clinician that's here. She's a doctor of physical therapy, graduated from the University of Marquette. She is in a fellowship program right now. She comes from a family of physical therapists. She's certified in vestibular disorders, dizziness, and she's a certified dry needling practitioner. Dr. Rebecca, who will return to our team after the first of the year. She's has a new baby at home. She's got over 10 years of clinical experience. She's specially trained in an applied movement science called Gary Gray, movement analysis. She was voted Physical Therapist of the Year in 2019. Our patients love her, and those that see her miss her and can't wait for her to get back. She's also certified in dry needling. We have a couple of physical therapists on our clinical team as well. Gina is specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper extremity specialist. Courtney is a physical therapist who's got a lot of experience in home health. She's specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper and lower body specialist. Lori Shates is an occupational therapist who I've known for darn near 30 years, who was joined our team very early on. She's a trainer and mentor for edema and lymphedema, amongst her other skills as an occupational therapist. And Robin is in the center of that picture right here. She's our wellness lead and neuropathy specialist. And then there's a picture of the rest of our team. We have Megan in the back. Megan is our office lead here. And she's got a specialty training as a chiropractic assistant. So, why are we here? We're here because we want people to make good healthcare decisions. So the problem that I saw was, and some of you may encounter, and see if this is correct, is that when you go and get an evaluation by someone, that they don't always necessarily offer all the options that are available to you in the community. There's a select number of options that are available. I have a problem with that. There's this thing, it's a very simple concept. And anybody heard of evidence-based practice? Yeah. Evidence-based practice just means that there's a confluence of 3 things. At the center of it is the patient preference. What does the patient want? There's also clinical experience of a provider. And then there's what does the research support? So we think of these 3 circles. We call that a Venn diagram. Well, when those 3 circles mend, when you have an approach that the person is in agreement with, when you have a practitioner who has skill and expertise in that area, and you have research that supports that area, and all those align, what do you think the chances of success of that intervention is? High or low? High. So if the patient likes it, the clinician supports it, and there's research to support it, chances are when that patient enters that treatment plan, they're going to have a very high degree of success. Make sense?
Mm-hmm.
Challenge is, if you don't know of all your options, how can you make a good decision? And simply put, that's what we try to do. Of course, we want people to enter our world, and we hope they sign up for coming in and getting a consultation and becoming part of our world, and we can serve them, right? We want that. Just as importantly, and in fact more importantly, is we want people to be educated on their options. Our message doesn't jive with everybody. I've got a buddy, he can't wait for the next surgery. Like literally can't wait for the next surgery. I'm not talking him out of it. That's his bag. He does well with it. I don't know why. He's a smoker, not a beacon of health. But you do you, right? Other folks are a little bit more like, hey, I want to kind of weigh my options. And of course, some people are like, no way, Jose, would I ever consent to a surgery unless I'm bleeding to death, right? People are all over the spectrum. We love wherever they are. We just want to communicate to them in such a way to be respectful and provide them information. And that's ultimately it. We've been putting on seminars like this for the last 6 years. We do this here, senior center, public events, church groups. You know, if you've got a group you want a presentation at, great. A retirement planner asked me to speak at their event for an add-on valuation to their clients to help them live better lives in their retirement. Most of those folks are trying to live a happy retirement. So we want to point people to natural options. That's what we do, right? So a little bit about us. So you're not here to hear about me, of course. I want to learn a little bit more about you. So, oh yeah, this is important too, right? Like, we're not going to say silly things like, you just have to live with it. Let's quickly run a test. Or, excellent. What service? Like, that is Jake. We're going to keep Jake on the payroll. So thanks, Jake. Appreciate it. Great hospitality, thinking about me like that. That's awesome. And we're not going to disrespect people by saying, and you can finish it with me, what do you expect?
At your age.
At your age, right? That's ridiculous. Like, we pay people a lot of money to say silly things like that. Like, that's not acceptable. So, this is your time. So, what I'm interested in is I've got content, and I think content tends to match the type of problems that we have here of people who come to these events, but I want to make sure that I'm going to meet your needs in terms of educational content. So I'd love to hear what your name is and what worry, concern brought you to the presentation. And I don't know. I'll start here.
Tim Olson.
Hey, Tim.
I worked with Sherry for many years teaching in the Oshkosh school system, but I am here because I've had years and years of left ankle abuse, sprains, torn ligaments. I've had surgery probably 15 years ago on it. I wear braces. I do the Arizona leather brace, and I do the plastic brace, which I have to wear if I'm out and about and walking, and wear one today here. So I've been to a few orthopedic surgeons. I want to avoid surgery. I don't like surgery. Could be 6 months to a year. The orthopedic surgeon I saw a few weeks ago, he said, you need a fusion with plates and pins, and that just scares the heck out of me. So I don't know if this, this is the right place for me or not, but I thought I'd take a shot, see what you have to offer. But it's fairly severe. So that's my story.
Quite a story. Thanks for sharing.
Yeah.
Appreciate it. Sherry.
Hi, I'm Sherry, and I came here. I have been coming here because of my neck and shoulders, just tightness and pain. And when they suggested a foot clinic, I thought I'll go there too, because I know I have knots in my feet. And I try to get them out at night by, I know they're there. And I'm just here for information.
Great.
What I can do.
What's your greatest worry about your condition? Your foot condition?
Weakness in the feet, and I know I have arthritis pretty much all over the body. But that, and, sometimes I get sharp pains.
Okay, thanks for sharing.
And I do wear, the, compression socks, which seem to help. Okay.
I'm Laura, and every now and then, there's a lot in the last week or two. If I take a step, it feels like my ankle's not working, like it's gonna collapse or I'm gonna fall down. So that's my major concern. I don't wanna fall. I did once, but luckily it was on the grass.
Sure. Okay, thank you.
Donna, I have nerve damage in my right ankle, foot area. I've got a piece of paper to show you. But my biggest concern is if it gets worse, with pain and stuff too, that, worry about walking, falling, like you said, falling.
Mhm.
So I just wanna see if there's anything that can be done. If there's already nerve damage, I don't really know if that will help or not.
Okay, thanks for sharing.
My name's Lorraine, and I actually came here first because I was, my friend told me to come here for my hands, and, but I've had trouble with my feet, kind of like what you've had. But since I was a kid, they said it was growing pains and never really went away. It's tolerable sometimes, but now it just, every now and then I'll get that sharp pain. It feels like you're gonna fall, but I don't know if it's in the ankle or what part of my feet. It's strange.
Yikes, that's scary stuff.
Mm-hmm.
Thanks for sharing. Bad ankles brought me to the profession. I had very troublesome ankles. I was a very heavy, obese child. I grew up in a restaurant, tavern, with very rich food, ate all the wrong stuff, and lots of it. And that brought me to the profession and brought me to a very keen understanding of the types of pain and problems that can pursue. So for me, it's personal, and it's a driving force of myself to stay active and remain fit and active, and share that with other folks. So I think our concept of what to expect as we go through the years and add birthday candles to our cake sometimes is skewed towards, well, I'm not sure I should do that, could do that, or kind of almost plan that we're going to be in a place of disability or difficulty. I think there's another way. So that's my story. All right, so biggest mistake ankle and foot pain sufferers make is they do nothing. Obviously, when nothing else changes, nothing changes, right? If you think about where you were at a few weeks ago, a few months ago, half a year ago, most of you are probably no better off then, right? The good news is you're coming here and making some, getting some education. We do say the longer something sticks around, the more challenging it is to recover to a point, but any condition can be improved significantly. Second biggest mistake folks can make is attempt to mask the symptoms without getting to the root cause. What that means is using non-steroidal anti-inflammatories, braces, pain gels, creams, non-steroidal anti-inflammatory prescription, and especially muscle relaxant and opioids, right? At times, some of those things may be needed, but when we consider some of these things, it's not just the potential side effect of some of those. Certainly, opioids and muscle relaxants have a side effect, but even the non-steroidal anti-inflammatories over the counter or prescription, non-steroidal anti-inflammatories carry some significant risks, and some of you probably know some of those risks for long-term use. What are some risks of the NSAIDs? Ibuprofen, Tylenol.
Every day.
Tylenol every day. What are some risks?
Kidney damage.
Kidney damage. Anything else? You've heard that non-steroidal anti-inflammatories can be bothersome for? Liver damage. Increased risks of cardiovascular events. There's even some emerging evidence that shows that non-steroidal anti-inflammatories, although they can relieve the pain in the short term to some extent, actually can accelerate the speed of wear and tear on joints. Another mistake folks can make is ignore comprehensive treatment for their condition, of their ankle and foot condition, and we'll learn more about what that looks like, a preference for a single solution. And then last one is looking at a single solution for all your problems. Oh, I'm just gonna get a brace, I'm just gonna get an injection, I'm just gonna get a surgery, something like that. I'm just like the next person, I would like a quick fix for all the problems in my life, right? There's rarely, for a condition that's been around for a while, a singular solution or singular approach that works. We're gonna talk about how our program incorporates multiple very successful aspects for recovery. And this is the big deal. We don't want to miss out on confidently moving forward on the things that are important for us, right? So favorite activities could be managing your house, managing your yard, getting out, spending time with those you love and care about, maybe family, maybe contributing in some sort of way, volunteering, or maybe some pickleball, sport, exercising, and the like, right? Like, who wants to stay home, right? The first thought when the phone rings and you pick up the phone and somebody wants to do something, wouldn't it be great if that first thought is, what do I pack? As opposed to, ooh, could I do that? Is my leg gonna hold up? Everybody's got their own thing, right? Some people are more active, other people just want to maintain their ability to be safe and not fall. So, we're gonna go over some common causes of ankle and foot pain. Common in terms of what people who tend to come to our events might be experiencing. Some of these include arthritis, tendonitis or tendinosis, flat-footedness, heel spurs, plantar fascia pain, neuropathy, ankle and foot joint stiffness, limited mobility in the big toe, nerve-related foot pain, lower back referred foot pain. So there's a number of things that can go on. We're going to go kind of through each one of these. First of all, arthritis. Arthritis is diagnosed and basically means that there's an inflammation or a change in the way that joint structure is. So the connective tissue of the cartilage, the joint, the surrounding bone underneath that joint can all have some change that are observable on x-ray. There's classically two types, rheumatoid and osteoarthritis. It used to be this thing with, oh, it's either a too much wear and tear, osteoarthritis, or more so a problem with the immune system, rheumatoid arthritis, right? Used to be like, that's how we thought of it. But there's a lot more autoimmune and immune system function that goes on in arthritis that's considered osteoarthritis than we like to think, but that's kind of classically how it's been thought of. Individuals with this kind of condition will have more pain after rest. So sit for a while and get up, starts to bother me a bit more. First thing in the morning, not good. But too much activity is not good either, right? Moderate activity tends to relieve it. And just these folks know they can't be as active as they'd like to be. So those are some symptoms, some indications from a symptom standpoint that someone might be experiencing arthritis. As we go through this, you might see some commonalities in some of these classifications. Tendonitis or tendinosis, that's a condition. So a tendon is what the muscles use to connect into bones, right? So if you think of, hey, if I'm going to flex my bicep and lift something, my bicep muscle has to have some sort of connection to the bone so that when that muscle activates, it can actually move stuff. The tendon is simply that connective tissue. On this illustration, it's the back calf muscle, it's this part here, right? So it's Achilles tendon. On this model, it's all that force comes into a tendon there. That area can become inflamed, irritated. It can also become weakened. And that's a condition known as tendinosis. it's a more recent understanding of what can happen to tissues. And you could think of it as ordinarily that connective tissue is very strong and robust. When you think about how small your Achilles tendon is, like if you can feel that, and if you think about it supports you when you walk up and down stairs, you can even jump up and down a little bit. That's a lot of force that goes through that joint, or that tendon, right? And typically the forces in that are very, very predictable and very strong. Anybody ever remember kind of peeling that grizzle off a tenderloin? So, anybody had that experience, right? That's a very thin piece of connective tissue, so your Achilles tendon is about the width of your thumb, so very strong. What can happen in tendinosis is that tissue becomes weakened, get like Swiss cheese effect on that. Tendons can feel weak. There can be swelling around the muscles, and that's certainly an indication if it's tendinitis, there should be an inflammation there, but tendinosis doesn't have to have swelling. More movement means more pain. Like you just can't be active. Anti-inflammatory medications may help to an extent, but we already talked about the risks of non-steroidal anti-inflammatories already. Tendinitis will oftentimes not show up on an X-ray, CT scan, or MRI. It requires a proper physical examination and history to determine that. Flat-footedness, another potential problem. Pain increases the more that people are on their feet. Pain is on the inside of the instep, on the inside of their foot. It can also be on the top of their foot as well. Foot can be entirely flat when someone's standing on it. You kind of recognize that, like, boy, that foot is really flat, right? You can recognize that if your feet are, the feet are wet and you stand on the tile floor, you'll see the imprint of your whole foot on the floor without that arch. You might get some relief when you put your foot up, but you're gonna have limited ability to move around, and you might get some relief with a off-the-shelf or custom foot orthotic. It's an illustration of flat-footedness there. So on the right is on your left is the normal arch. There's relief on the inside of that step. Flat-footed is where that whole arch collapses, is flat. On resting CAT scans, CTs, and MRIs, you won't find that. That's a functional or it has to be something that has to be observed from a clinical examination. Heel spurs. So I'll describe heel spurs, but it'll take a moment to describe the basic anatomy of the ankle and foot first. So this is a right ankle and foot, just the bones. Lower two leg bones, the bigger one is called your tibia, the outer one is called your fibula. They create a little dome with which this first foot bone sits underneath. This joint should have a vigorous amount of bending. We're going to talk about that in a little bit more. So if we think of a foot, someone standing at attention, that should be about a 90-degree or right angle configuration of the lower leg bone to that foot. When we walk and we put weight on that foot, ideally we'd bend forward to about 20 degrees total, and then we'd shift our weight to our foot, it'd come up, and we'd be ready for the next step. This is called your talus. There's a bone underneath this. I'm going to pass this around. You can play with this. These are fun. The talus is your heel bone. Okay, so the bottom is where your heel strikes. Top portion here is where your calf muscle comes down and inserts into. So you've got your tendon here, your calf muscle, back in here, that inserts into this bony bump. And the bottom of this, you have connective tissue that goes from that bone and fans out to all the toes. So this bone almost serves as a teeter-totter, balancing the forces of the connective tissue on the bottom of the foot and balancing the tissues of the calf muscle. So bones use thickened bony areas for connective tissue to attach to. So heel spurs when there's excessive buildup of bone tissue right at this lip, and that area can become inflamed and irritated. That's what a bone spur is. So there's so much force on that bottom tissue, the body decided, hey, I'm gonna lay some extra calcium down to give it some reinforcements. So We'll illustrate that in a clinical perspective. As long as I'm onto this, I like talking about ankle and feet. So keep in mind that we just don't have a flipper in the bottom of our foot that just moves up and down like this. There's also a lot of in and out motion that has to occur even when you do simple things like walk. So there's a bit of a tilt action sideways and in that has to happen with this heel bone. And also this bone will have a little bit of that. Front of the foot. These intermediary bones will also have a fair amount of movement that should occur within the right circumstances. So, foot's fairly complex, but I want you to pay attention to this joint here, how that works, and then how this heel bone works, and then play around with these bony bumps here. Yes?
Can heel spurs rub against or irritate your Achilles tendon?
They actually can.
Okay.
Yeah. It's not often, but they can.
Okay.
It's a good question. So heel spurs, people with a heel spur, and they kind of know it. You take one finger and you point to it. Ouch, it hurts there. Right? There could be an expansion of irritation from there. First steps in the morning, awful. Like searing pain. More steps, yeah, it's a bit painful, but it can tend to go away a little bit. These people may have been advised they have a heel spur on x-ray. Cushion shoes may help to a point. Pulling toes back increases pain. In other words, if you cross your leg and you pull your toes back and you're like, ouch, right? That could increase irritation in that heel spur. But it can also increase irritation in the next thing we're going to talk about as well. Oftentimes when someone's foot is x-rayed, if they see an accumulation of extra calcium there, the diagnosis is made immediately, and oftentimes there's no physical examination made. And that's a mistake, because I'll do a spoiler alert, there can be more than one thing going on at a time, number one. And just because you have excessive bone accumulation somewhere doesn't mean it's going to be painful, or the source of your pain. There's a side view. This is a heel spur, a little bit of a buildup of extra bone tissue there. This is a side view, again, heel bone, talus bone, and your midfoot bones. That's kind of related to plantar fascial pain. So it's an illustration of connective tissue that goes from the heel to the toes. And that white tissue here, and that connective tissue can become irritated and can be related to heel spur. Pain anywhere from the sole of the foot to the toes can occur. First steps for this will be very painful. More steps are painful, and they may have also been advised they have a heel spur on x-ray. Cushion shoes can help, so there's lots of similarities between these two. Pulling toes back increases pain. Neuropathy. Neuropathy is a condition in which pain in the feet doesn't seem to be related to physical activity. These individuals may have a wide variety of symptoms that might include pain, numbness, tingling, feeling like they're stepping on sponges, and again, may not vary much with activity. And oftentimes it starts at the toes and can move up towards the middle of the foot, towards the heel, towards the ankle, in what we call a sock-like distribution. Pain may continue to seem to be coming closer and closer up towards the ankle and the calf, and maybe even some individuals move up to the knee. And some individuals can't feel so much in their feet. Or their feet can be too sensitive. Even the weight of light blankets can be bothersome for the feet and toes. These individuals oftentimes have a significant amount of pain even at rest. Neuropathy, we have a specialty neuropathy clinic here. It's generally a condition that hasn't been, people haven't been offered very many options other than pain medications and just watch people deteriorate. So we have a successful program here to assess and treat that if it's the type of neuropathy that we can help. Ankle and foot stiffness. So every joint, if you think of it, has a connection between two bones, and there's cartilage to reduce the friction between those two bones. Typically, there's going to be some sort of ligaments. Ligaments connect bone to bone to prevent excessive movement, and most joints have joint fluid. There's a capsule that surrounds that joint fluid called your joint capsule. That joint capsule can become stiff and irritated. Why does it become stiff and irritated? There may be some inflammation that goes on in an area. You may have some pain and kind of limp for a little bit, and then because of that, it stiffens up and it doesn't self-correct. So this is a very common condition. This would be these would be some symptoms that people might experience who have ankle and foot stiffness. The feet might feel stiff in the morning or after sitting for a period of time. Over time, it seems to be getting worse. Medications don't seem to touch it a whole lot, maybe take the edge off. And maybe some of the stretches seem to be helpful. Everybody has a friend who gives you some stretches or does some doctor Googling and maybe finds some things, oh, maybe this will help. And but it's not going away. Always seems to come back. And if someone's honest, it's really getting worse. The one thing that does happen as time goes on, because you add birthday candles to your birthday cake, tissues are going to be a little bit stiffer each year, right? It's one thing we probably can't deny, right? But that's very real, can lay hold of it, and that contributes to that joint stiffness as well, which is not a good thing. That stiffness could be in that ankle joint, that flipper joint. In this joint here. Or it could be in the underlying joint here, or even in some of these joints here, or all of them. So we call that rear foot or midfoot, and this, because most of medicine is so based on just x-ray findings, will not show up on CT scan or MRI. Only with proper physical examination can this be determined. Limitations of big toe. Pain at the base of the big toe. May have been told you, or you can observe a bunion, right, where that big toe kind of goes towards the little toe. And that can be associated with a condition we call forefoot inversion, just the way the muscles and the system controls the ankle and foot. That foot kind of collapses in. So we're talking about, if this is your foot, this particular joint. What can happen is if you're standing, that stiffness prevents this type of motion. That type of motion is necessary when we step on our foot and when we do the heel off. Basic rule in the body, what one part doesn't do, another one tries to make up for, right? Just like my stepdad always said, if the head don't do it, the feet got to make up for it, right? In this situation, movement's got to happen, force has got to happen somewhere. You're going to walk, right? So if it doesn't happen here, okay, then it's got to kind of happen somewhere else. And somewhere else is going to get strained and irritated because there's not enough mobility there. Nobody wants to look down and see that on their foot, right? But stiffness in the great toe doesn't always mean it has to look like that either. And to some extent, if someone does have the appearance of that, there can be a significant amount that can be done to help improve that condition. Nerve-related foot pain. So when you have a problem that hangs around for a long period of time, the nerves get irritated. They get hair triggered. Okay? In other words, nerves at rest, if everything is calm, they should be just a little bit active. Typically, it should take quite a lot for a nerve to trigger a response. When a condition is around for a long time, instead of your nerve being nice and calm, its resting position is closer to being where it's going to trigger a response. Okay, it's kind of like when, I don't know if it's ever happened to you, maybe I'm the only one, got a lot in your mind, a little stressed, someone says a joke or says something to you that ordinarily you would think is funny, but you're kind of thinking about all the kind of stress that can go on, and you kind of overreact, you blow up. And later on, maybe, hey, I'm sorry, I'll walk that back. I was under a lot of pressure, right? a lot of stress. Well, nerves feel that too. So when a condition's been around for a while, those nerves, those regional nerves in that area are bothered. They're jacked up. The nerve connection from that area to the spinal cord and back to that area are accelerated, right? You can have that nerve is just irritated. This is a little different than neuropathy, but could be related. For these individuals, very little pain will produce a lot of, very little activity can produce a lot of pain for a long time. Pain can be excessive for the type of activity. These individuals, oftentimes, they have to wait to build up a couple days for some activity, and they pay for activity for a couple days thereafter. And there may be a number of diagnoses with nerve-related pain. It could include plantar fasciitis, Morton's neuroma, or some nerve entrapment problem. These are issues where the nerve is basically jacked up. These do not tend to show up on CT scan, MRI, or x-rays. Lower back-related foot pain. These individuals may have pain for a long period of time. They may get some treatment relief, but it generally doesn't go away. It sticks around. It tends to fluctuate, sometimes without even a lot of change in activity level. Like, it doesn't make sense. May or may not have a current report of lower back pain. Most of these individuals probably have a history of lower back pain somewhere that they may have forgotten. So, how does this happen? Well, the nerves to your foot and leg come from your back. So there's a couple of vertebrae area that when they send the nerve signals down to the leg and receive signals back from the body, if you've got a problem or a stiffness pattern or something's not optimal in an area, you can get that nerve is irritated to cause that pain. When an individual has that, it feels like, and the nerve is responding like there's something wrong with the foot. But it's actually a lower back issue. If we're not aware of that when we assess somebody as a possibility or looking at the symptoms, we can treat that ankle and foot till the cows to come home. But nothing's going to change. That's why I say it doesn't show on CT scan, MRI, or X-ray, because oftentimes the scope is just, oh, it hurts there, I'm just going to examine right where the yowie is.
Given, all of them.
Almost always. So, that's a good survey of a number of things that can go wrong with an ankle and foot. And so what do we do about it, right? Well, first of all, you have to get to the root cause and what's going on for that individual. So what we have is we have this thing called the 5-minute miracle. It's pretty straightforward. What this is just gives you a chance to see maybe some aspects of the kind of history we take and the physical assessment we take, and some of the techniques we might use on someone who has a foot problem. So we usually select somebody in the audience for that. It maybe takes a little longer than 5 minutes, but 5-10-ish minutes. And then we take a look at what some corrective work might look like, see the response, and then we can have a discussion of what that looks like for that individual, and then what a prospective plan of care might look like to get over that. So that's what we're in store for. So I'm going to pick on somebody, hope they're brave. You up for having your situation looked at? All right.
As a kid, never really diagnosed. Well, except growing pains. I did the orthotic thing. I did all that. Recently, I've done nothing. But when this came up, I thought, well, if I'm going to look at my hands, I might as well look at the rest of it too.
Sure.
Got it. So, and right now, your biggest complaint is?
That numbness in my toe.
Okay.
Okay.
So if you don't mind, take off your shoes or your boots, please.
My hands are terrible too.
What do you like to do in life as we know it?
I do a lot of gardening. I always call them my summer feet. That's when I probably abuse them pretty good in the summertime.
Great.
And I have the pain. Once you rest, you're pretty much done with
Got it.
walking or anything like that.
Got it. Would you mind doing two things. Number one, maybe folding your pant legs up 3 times each side a little bit. There we go. And taking off your shoes. Taking off your socks.
Nail polish on my toes.
All right. Remnants of summer. All right.
Yeah.
Okay, and show me again where you experienced symptoms.
This is, I told it it's cold. This is where they feel like this has just been recent pain. They get numb.
Got it.
I haven't had that before. But what I do have is it feels like my foot is giving out. It's usually this one. And my feet swell up too.
Got it.
Today they look not too bad this morning.
All right. So the feet swell up.
Mm-hmm.
Right ankle seems to give way. Some weird symptoms in that left. So there's enough going on. History of lower back pain. So
Mm-hmm.
we might be in for some exploration. So that's great. So what I'm going to do is I'm going to have you do a couple things, please. Just in a few moments, I'm going to have you come to standing. If you stand, we'll have you take a walk. Just kind of get a sense of your walking, moving, and then I might have you do some other type movements to get started, and then we'll get into a physical assessment. Fair enough?
Okay.
Okay. So if you would please, without your hands, come to standing. Cross your arms.
Stand.
Great, thank you. So I'm going to take a walk across the room. That's it. Got a little back trouble going on there?
Hmm?
You just tuck in your shirt, or you feel a little back trouble?
Yeah, there's pain.
Okay, come on back. How about in the ankle and feet? Anything unusual in the ankle and feet right now, at this moment?
Not too bad. I can feel it like crack when I.
Why don't you walk a little quicker?
This morning when I got up, I was limping quite a bit. I have that every morning.
So on your left leg? Hard to say.
It's hard to say.
Okay.
And
One more time.
sometimes you just think you're just
One more time.
used to limping.
Yep.
Unfortunately.
So over her left side, there's a little bit of hesitancy to put weight on there. I don't know if anybody senses that. All right, thank you. Stay standing, please. Come on,
Okay.
you. What I'm going to do is I'm going to have you turn your face away from me.
Okay.
Here. One more. So I'm going to take a look at her spinal mobility, right? Because she has a history of spinal trouble. So this, this is something we oftentimes do. Go ahead and bend forward, please, as it touches the floor.
Oh, jeez.
That's it. So she's a little groaning, but she's got good spinal mobility in that direction.
Mhm.
Come on back up. Thank you.
I can feel that right there.
She feels a pull there. Okay. And now I'm going to have you bend backwards. You notice the little groaning there?
A little bit.
Bothersome and stiff in the lower back? What's
A little bit. It hurts now.
Got it. And that right side. Okay.
Mm-hmm.
Slide your left hand down the side of the left leg.
Crunch, crunch.
Any change there? Down the right
This
leg.
is too hard to tell.
That's stiff, right? You feel that? Yeah, so there's a
Yeah.
fair amount of stiffness over on that right side, right? So,
Yeah, I think I've pretty much always had.
happy. I'm gonna have you sit on the chair then. We're gonna do a localized, so I would probably spend some time, like I don't believe that, Lorraine has just likely one thing going on. She's got obviously both feet going on, different type of symptoms.
Mm-hmm.
We're gonna take a look at a focused assessment of her ankle and feet so you can get an idea of what that looks like. I'm not sure what difference you'll notice after this in terms of the finding the miracle aspect of it, but we'll get a good view of the assessment. If you would please raise up your right leg. First thing I want you to do is pull your toes way back as far as you can. So that's that flipper motion. I'm going to measure that. So
Okay.
I'm with knee straight. I'm aiming that pull back all the way. I would like her to have at least 15, if not 18 degrees of that. On this side, she's got 20. So check. The flipper motion is pretty good. On the other side, go ahead and pull back here. On this side, pull way back. On this side, there's not as much motion. There's literally 4 degrees of motion. Like so, just to give you a reference, if this is her lower leg and this is her foot, on her right foot, she's got 20 degrees of bend. On her left foot, she's got 1/4 of that. So that's a big difference. Okay, that's concerning.
Okay.
So that isn't doing something else her foot is making up for. Okay, so that's got my attention. She indicated that her left foot's more bothersome towards the front of the foot. So there's some ideas that might form in my head, but I want to be careful not to jump to too many conclusions. We just want to see what is. Raise your other foot up, please. So I'm going to assess a couple things in here. This heel joint, you can do real gentle things, should have the ability to have easy motion and work, beautiful motion. Even this base foot joint should have a little bit of motion there. So I'm stabilizing with my left arm, giving her a little bit of assessment of that joint. I'm going to see about in and out here. That's about right, not bad.
Okay.
Or check that big toe. The big toe bends back quite a lot. That's more than enough mobility in your big toe. Great. I'm gonna take a look at your other foot. What you're gonna do, sorry my hand will be hiding that a little bit, but how much motion is in that hind joint compared to the other side? Which one has more?
This one has more movement.
A lot more. You can probably kind of sense that movement a little bit, but there's a profound stiffness in that heel joint, for sure. I'm gonna go up a little bit closer and also look at that other joint. Not horrible there. We'll take a look at our midfoot here, and there just seems to be more stiffness there than the other side. I don't know if you can sense that. Take a look at the big toe. Okay. Big toe's happy there, so good. I like that. So, I don't have her entirely sized up. Okay, she's got a back issue that I believe for her to move well, especially given how stiff she was, and maybe from your perspective you couldn't see that, but she's got okay backward bending, like not bad, but that should be better. Like we all need a little bit more backward bending. That's not her main problem. When she bent to the right, her spine is not happy to do that. So that in a care plan can be easily addressed and will help her to move a lot better. For her foot right now, the biggest thing I find is that heel bone, for whatever reason, in her history, got stiff somewhere along the line. I don't know how. I didn't follow her. How old are you now?
63.
I didn't follow her around the last 63 years. I don't know what happened to her, right? But I know that right now, that ankle joint is very stiff, right? So I'm gonna do a little bit of work on that. You can see what that looks like. We'll have her test that, and we'll measure it afterwards and see how she responds. So if you would please, raise your foot up. So I'm doing a technique called joint mobilization, right? I'm selectively addressing a particular individual joint with gentle, comfortable mobilization techniques. This is okay for your knee, I presume, right? Not straining your knee or anything?
Nope,
Okay.
not at all.
So there's different ways to affect joints. I could do a quick stretch, like crack it, if you will. And that's a technique that sometimes we do. But this gentle, easy motion is very effective. Again, it's called graded, G-R-A-D-E-D, mobilization. We're mobilizing that joint connective tissue in that joint capsule in a real localized fashion. And as we continue to move here, you probably sense something a little bit differently about how that joint is moving now. Would you agree? What do you notice?
It feels like it's moving more easier,
Right.
more motion.
So, check. She responds to that. Nearly everyone does. Put that foot down. We're going to remeasure your ankle motion.
Okay.
We're just see if we can do one thing and how that influences you. Straighten your leg up, please. Pull your toes back. Pull your toes back. Nice. I can tell right away that there's a bit more motion there. Not probably where we want it. That motion is closer to 10 to 11 degrees. We doubled your return. About half of the other side. She's actually a pretty flexible gal, and that's great. But the flexibility doesn't match left to right. And that's going to be a problem for her until it's corrected. So, if you would please,
Okay.
come to standing. Take a walk again. And notice, don't think, just kind of feel into your body. What's different about the way you move now? Walk back and forth here. What do you sense that's different? Like everybody's gawking at you. You're probably thinking a little bit.
Yeah.
Just kind of feel the flow into the movement. Couple more times down and back. This can be really hard to kind of pay attention to the felt sensation in the body. Team in the audience. here. What do you notice about her walking?
I'm not paying attention, I'm sorry.
It seemed a little easier for her.
Yeah,
A little, yeah.
right. She didn't have a horrible walk to begin with. So, you know, oftentimes, you know, you weren't helping me out. I didn't pay you enough for this.
Well, when I got up this morning,
Right?
I was limping.
You should have
this
caught me at that
morning.
time. I mean, some people, they get up and they've got a really pronounced swagger. Like her, you have to kind of look at it like, oh. But most individuals can kind of sense that, right? Like,
Mhm.
when we're paying attention. So, I tell you what, come on up one more time. Okay, leave that go. So it's a bit more smooth. Again, I mentioned before, it feels smooth now.
It does.
Yeah. A lot of, you know, you're
A
getting
lot
up,
of it, yeah.
you're getting up from this experience, you're like, what should I be feeling? Everybody's looking at me, you know, all sorts of things are going through your mind, and that's all on your thinking mind,
Mhm.
right? The feeling mind is a little different. The second time she accessed that, so I'm not trying to influence that experience. I want people to find that themselves. I'm trying not to project what I think is going to happen on them and say, oh, that feels better, doesn't it? No, it's like, what do you notice, right? Like, so when I see a change, that I can measure, that we can feel when we do that specialized test, that I can, you know, sense when she moves, ideally she would feel that too. Some people catch on to it right away. And other individuals might take them a session or two to kind of get used to that kind of way of thinking about it. Because most of the time we're just thinking about stuff, right? So I'm doing a happy dance. That is a good outcome, okay? Now, that's not solving all our problems, right? She's got more to do there. We're going to talk about that because this obviously leads to the next thing. So first of all, thank you.
Sure.
Congratulations. Next is the obvious question. You can stay there. You're fine. The obvious question is, well, what does she need from here, right? Because, you know, if she just goes about her life, if she does nothing else other than this, her ankle and foot might be a little looser, but that ain't gonna solve her problems, right? And she just can't come here and get her foot twiddled around all the time and expect to get better, right? So a couple things have to happen. At the end of the day, we're movement. We move in the world. And when there's stiffness in joints that prevent us from moving well, that stiffness needs to be relieved. All of that stiffness, no matter how long she's had that, I believe, based on how well she responded today and her overall health status, should become normalized. Her left foot can't get to the point of her right foot. The challenge is, like, it's not a screaming pain at her, right? But she does experience some discomfort in the front of the foot, so we can think that, hey, her ankle's not doing the work. Increased pressure is happening in the front of the foot, which is irritating that area, is most likely the symptoms causing there. She needs more work in the ankle and foot, in the front of the foot as well. So we need to restore that normal motion. That's in the restorative or corrective stage of intervention, right? So not a high degree of pain other than the morning, but there is some. So the first thing she might notice is tomorrow morning it might feel a little bit better. It may
Well, I
not.
also have, like, by the end of the day, I'll have the lines from my socks that be too tight because it's all swell up.
She's a complex gal. There's other things we've got to kind of delve into, right? At the end of the day, that's what we're aiming for. We're aiming for more motion in there. And then as she gets more motion, what do the muscles need to do? Probably get stronger within that newfound range, right? And then we have to find out exactly what she likes to do. Like she talked about gardening, there's probably other things, but then we have to prepare her for those sort of things so that at the end of the day, she has a nice way of not only maintaining her ability to get around the house, but being confident to do the things that she wants to be able to do. Like, I don't know, maybe she likes to go shopping and get Kohl's cash. Who knows, right?
I do riding in a car, riding in my husband's truck is terrible, and I think because I can't really reach the floor
Got it.
because I'm short. And do a lot of motorcycle riding, and that's getting harder and harder by the
Okay.
time we put on a few miles, everything.
Right, so you know, her and I, you know, this is a very abbreviated, you know, physical history, or history taking, right? But we're gonna find out, hey, what are the things you wanna do, and then what other things do we need to do? So joints need to move, muscles need to be strong in those newfound motions, and we're probably gonna do some strength development type exercises, right? so that she's confident when she gets back to gardening, that she can pick up a potted plant off the ground.
Mhm.
Her feet move well, her muscles are well, she's stabilized, and probably address that lower back issue, right? So she's got a number of things going on, right? And everybody's unique, right? No two assessments are the same, no two treatments for the individual are the same, because over time, care plan is, yeah, we're doing a fair amount of stuff for her to free up those joints, then we're teaching her how to do that herself, then we're teaching her muscles how to get strong, then we're game planning how to get her back to confidently riding her motorcycle and the things that she likes to do, and who knows what else she's interested in around. I would suspect she likes going to, like to go to fairs, stuff like that, like maybe,
Mm-hmm.
yeah, for sure.
I've retired this January for 2 years, so
Nice.
I got a lot to do yet.
Excellent, you're my kind of gal. So, that's a little bit about, in that plan of care, we outline simply, and I'll get to that in a minute. So when to consult a doctor of physical therapy? So, when pain keeps people from doing regular activities, right? Regular activities they enjoy doing, if they're starting to pull back from those activities, keeping up with friends and family is getting more difficult, or the concern thereof, worried about maintaining or upgrading your fitness activities, right? Like, it's pretty tough to think about fitness walking when you're gimping around and have trouble just in the morning, just getting up out of bed. When pain prevents you from standing more than 30 minutes, right? Pretty tough to go to a carnival or event if you can't stand for a period of time. You're fearful of losing your independence and want others or yourself to stop worrying about, will this get worse, right? And you keep kind of massaging, slathering lotion on there, taking over-the-counter medications, just kind of spinning your wheels and not getting stronger. We're not about pain relief. There's tons of ways to relieve pain. You could have a good couple drinks, you could take some medications, hot tub, a whole number of things that people can do to relieve pain. We don't want people in pain. We want people to live life fully while minimizing pain and being strong and confident in the sort of things they want to be able to do in our world. And of course, bias towards minimizing drugs, injection surgeries. Nowhere in there was any mention of those sort of things. Am I a fan of some nutritional approaches and some nutritional supplements that might lower levels of inflammation and pain? Of course I am. People can choose to use those or not, but we're more biased towards the non-pharmacological approaches. I'm excited to come to work every day because as a modern evidence-based physical therapy practice, we provide joint mobilization. You just had a chance to see that today. Or manipulation as needed. We can provide massage work, right? Deep muscle massage work for those muscles that are irritated, tight, swollen, that sort of thing. You didn't see any of that today, but we can do deep tissue massage work. We develop an exercise prescription that's individualized to an individual that is specialized to them and progressed over time. Develop a strength program to help people get back to their active life, whether that's yard work, exercise routine, pickleball, travel, whatever it might be for that individual. And we can also provide dry needling, which is a use of acupuncture needles to help assist in pain relief and nerve, calming nerves down, if that's something that someone's interested in. And then we also provide a specialized neuropathy program with several vital components. I don't believe anybody here has neuropathy, but there is a neuropathy program we offer as well. We use electromagnetic infrared therapy. We use a specialty type of horizontal electrostimulation that just doesn't mask the pain, but actually helps the nerves to recover. We use advanced nutritional therapy and a whole wide variety of activities and in-clinic education and consultation with coaching. I see there's hope and a pathway for healing. So we believe that modern doctor of physical therapy is a provider of choice for musculoskeletal problems, for non-drug care, using all sorts of tools that you can benefit from to get to your results. Talked a little bit about a plan of care, and here it is, right? Early phase. Someone's kind of like really infirmed. They're experiencing lots of pain and inflammation. We want to relieve that pain and inflammation, get them to the next stage where we correct the root cause of some of those problems. Could be muscle balance, could be postural misuse, could be some tightness in those joints. Then we want to build that strength. So as the muscles move a bit more, we want to develop increased strength. At the end of the day, muscles need to manage your weight and manage the weight of the world as you're lifting, bending, twisting, and get back to a lasting pain relief to be as active as you want to be, and picking up the phone. I'm ready to do whatever my friends or family ask of me. I think I have some accounts of individuals we've successfully worked with here over the years, and so I think we included everything. So